I'm Nicole, and today we'll be going over Heent assessment. So Tiffany, today I'm going to assess your head, neck, ears, eyes, nose, and throat.
Wonderful.
Let's begin by asking you a few questions. Do you have a history of headaches?
No.
Any dizziness?
No.
Any head injuries?
No.
Have you ever lost consciousness before?
No.
Okay. Do you have any blurry vision?
No.
Any double vision?
No.
Do you wear glasses or contacts?
No.
Have you had any recent visual changes?
No.
Have you had any trauma to your eyes?
No.
No, so no recent changes in your vision, no past eye diseases or current ones? No. Okay, lovely. So how about your ears? Do you have any hearing loss?
No.
Any ear pain? Any discharge? No discharge. Okay, that's good. We don't want that. Any ringing in your ears?
Yes.
You have a ringing in your ears?
No.
No, you haven't. Okay,
Sorry.
okay. It's okay. Have you had any vertigo?
No.
Okay. Do you feel congested?
No.
Any postnasal drip?
No.
Any nosebleeds?
No.
No? Okay. How about your mouth? Have you had any teeth problems before? No? Has your throat felt hoarse, or have you had a sore throat?
No.
Your voice has been okay? No problems there. Okay, and have you noticed your gums bleeding when you brush or otherwise? No? Okay, great. Any ulcers in your mouth?
No.
Okay. Well, let's move on to the physical portion of our assessment. So we're going to look at Tiffany's face, look at her head, her scalp, her contour. It's everything appears to be midline. You also want to look at her scalp, which I will. Okay. There's no ulcers or any abnormalities there, any rashes or deformities. Next, we want to check her temporal arteries, palpate those, and those are nice and strong. Next, we'll inspect Tiffany's neck. If you look midline, it's beautiful. There's no deviations. It's symmetrical. There's no jugular vein distension. We're also going to palpate Tiffany's trachea. Any tenderness? No. And there's no masses present as well. At the same time, we're going to palpate the carotid arteries one at a time. And we're also going to listen for any bruits. And there are no bruits noted. So that's great. So we're going to have, Tiffany, I'm going to feel your thyroid. I'm going to stand behind you, and I'm going to ask you to swallow when I tell you, okay? So you're going to stand behind your patient. You're going to find your cricoid cartilage. And Tiffany, if you could swallow. Okay, and I was able to feel Tiffany's thyroid during that test, and there are no masses or anything noted. So next, we're going to check your lymph nodes, see if any of them are enlarged or removable, okay? So you're going to check your preauricular, your postauricular, your occipital back here. I'm going to check your tonsillar, your submandibular, your submental here. Now I'm going to go down here and feel your anterior cervical, your posterior cervical, and your supraclavicular. And there are no enlarged lymph nodes noted. Next, we're going to check Tiffany's vision. So I'm going to step over here, turn on my light source, and I'm going to check Tiffany's pupils that they are equal, round, and reactive to light and accommodation. So Tiffany, if you can look straight ahead, I'm actually going to get this tool here. And if you could hold this right here. Okay. So you're going to tell the patient to focus straight where she is. I'm going to put the light over the eye, see it constrict, and I can see that the right eye constricts. Now I'm going to do the same thing in the right eye, but check in the opposite pupil. Okay, and you should do that with the other eye as well. Thank you. While I have that there, I'm going to have you cover one of your eyes, and when Tiffany removes the eye, I'm going to check for any nystagmus, any eye muscle weakness. So can you remove it? And there was no eye muscle weakness. Okay, so next we're going to check for accommodation. Tiffany, if you could just focus straight ahead, and then I want you to focus on this object, and I'm going to bring it in, okay? So there's where we check for accommodation. We check for the eyes to converge and the pupils to constrict. So next we're going to check the 6 cardinal views. So I'm going to come over here. Tiffany, please follow my fingers with just your eyes, not moving your head, okay? And you want to make sure to go in each quadrant. Make sure your patient is able to follow, Lovely. So now we'll check Tiffany's peripheral vision. Tiffany, let me know when you can see my fingers, okay?
Okay. Yes. 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 Yes.
Okay, so Tiffany's peripheral vision is intact. So next we're going to check the light reflex, and I'm going to check this by shining a light on Tiffany's nose. Please look straight ahead. So you want to make sure to be at the level of your patient. And you're going to look for any deviations and to see if the cornea symmetry and it all looks great. So now we're going to check the fundus. I'm going to bring in my ophthalmoscope again. So I'm going to hold this to my right eye using my right eye when I check the patient's right eye for maximum patient comfort. Look at this. Find the red reflex. And you're going to fall all the way in. Sorry, Tiffany. You can look straight ahead. Make sure my light's working. There we go. Straight ahead. And make sure this. Follow that all the way in. Looking at the patient's fundus and her structures. And there's no masses or scars or bleeding or any abnormalities noted. And then you would follow, do the same with the left eye. Once again, using your, your left eye when you check the patient's left eye. So next, Tiffany, I'm going to have you check the Snellen chart. So if you could stand for me here, and you'll want your patient to stand about 6 feet away. If you could cover one eye and read the smallest line possible.
So FELOPZD.
Okay, wonderful. Would you be able to do it with the next eye? Cover it, please.
Definitely not.
Okay.
So my best one would be FECFD.
Okay. Now if you could do it with both eyes, none uncovered. Thank you.
So the best one, DEFFOTEC.
Perfect. So that would reveal that Tiffany's vision is about 20/20. So you can have a seat now. And now I'm going to look at Tiffany's ears. So if I come here, you're going to look at the outside, look at the pinna, look for any redness, any discharge, feel it for any tenderness before you use your otoscope. And there's none there, is there? No.
No.
Okay, so I'm going to turn on my otoscope, bracing it with my right hand as I come in an adult, pulling up and back. And you should visualize the tympanic membrane, and that should be a nice pearly gray color, which it is. Okay, and then you would do the same thing with the other ear. So now we're going to do the Weber test. So I'm going to bang the tuning fork, and I'm going to have Tiffany, I'm going to have you tell me if you can hear it better in one ear or the other, or the same. Okay?
Same.
Okay, lovely. So now we're going to do the RIN or RINI test, which tests air conduction versus bone conduction. So I'm going to put it behind your ear on the bone for Tiffany to test for bone conduction, and then I'll put it beside your ear to test for ear conduction. So just straight ahead. Tell me when you can no longer hear it.
And now.
Okay?
Now.
Okay. So that was 15 seconds for air conduction and 10 seconds for bone conduction. So that's normal. So next we're going to look at Tiffany's nose. Looking at it, symmetrical, no discharge noted. Turn my light source on. And I'm going to push the nose up a little bit and visualize the patient's nose, looking for any polyps, any redness, any discharge, and they look great. There's no abnormalities noted. So next, we're going to palpate and percuss the sinuses. So I'm going to palpate frontal and maxillary, and then I'm going to percuss it for any tenderness. Did that hurt?
No.
Okay, wonderful. Okay, so now we're going to check Tiffany's mouth. So Tiffany, if you could say ah. Okay, so there's no lesions or ulcers noted. Just going to put my gloves on here. Feeling for Can you open your mouth, feeling for any ulcers or masses? There's no abnormalities noted. Next, if you can open your mouth, I'm going to tickle the pharynx and see if her gag reflex is intact. And it is in fact intact. So lastly, I'm going to test your tongue strength. If you can move your tongue from side to side, up and down, and then against each cheek, and feeling gets that. Wonderful. So that concludes our Heent assessment. Let me know if you have any questions.